This segment of Delmarva Live is brought to you by Delmarva Dental Services.
When you think of a dental issue, you probably think of something like a cavity or a chipped tooth, maybe even sensitive teeth. Of course, those are all important problems that we know need to be addressed. But have you ever heard of something called a dental abscess? It's a condition that can cause quite a bit of pain and quite a bit of damage to your heart and other organs. And that's why it too needs to be treated. With us this afternoon, I'd like to introduce to you Dr. Lee Auke and Dr. Irene Sakelis, both with the Delmarva Dental Services. Thank you so much for joining us this afternoon.
Thanks for having us.
So, tell me give me a definition of an abscess.
An abscess is something that forms caused by a bacterial infection. It's basically like a pus pocket that develops when you've had a concern or a problem with a tooth.
Okay. Do I understand there's like two different kinds?
Yes, there are two different kinds. It can be either related to the tooth or it can be related to the gums. So the tooth is usually where an infection in the nerve has either cavity or some kind of infection from the tooth has kind of leaked out and causing pain from the tooth. Or it can be due to bone loss or infection within the gums that can cause this abscess.
So it can be different things causing each of the different abscesses?
Right, yes.
Okay. So I'm sure this would be something I would feel if I've got an abscess developing or already have it. What would I feel?
You could feel a variety of different things, and actually one of the scariest things is if you don't feel much of anything. So you could have a nerve die and not know it, and that's again one of our big pushes for making sure we take our routine x-rays, because we do find things like that on those images for patients. But you would probably feel the beginning stages of a nerve dying. You might feel cold sensitivity, hot sensitivity, lingering pain. It could be from a cracked tooth or a trauma also, so you would probably know more quickly if that were the case. But you could feel swelling, heat, pressure. You may even feel like a unlocalized pain. It might feel like it's referred to the upper teeth, the lower teeth, up to your temple, back behind your ear, down in your neck. And that's all related to the anatomy of the nerves that you have within your jaw. So you could feel a variety of different things.
My goodness.
Yes.
So this really is something we need to pay attention to and get taken care of. Yeah. Is there any way to get an early start, an early idea that something's coming?
Yes, absolutely. So this is why dentists, and especially here at Delmarva Dental Services, we harp on routine checkups. Every 6 months, come in, get your cleaning done. That way you avoid the periodontal issue, but then also getting your x-rays, making sure that the nerve, there's no small cavities forming. So that way if there are small cavities, you go ahead and get a small filling, avoid any kind of infection to develop. If you do end up with an infection, okay, there are solutions for that as well. But with x-rays, that's the only way you can see that. You can't just look in your mouth and say, oh, I'm good. All right, see you next year.
That's it.
So doing those steps, that's really what it's all about.
Now, we mentioned when we started that this can affect other parts of your body.
Yes.
How so?
Yes, so especially like the heart and the brain, there are all kinds of connections between your mouth and your other organs. And for example, for a person who's already immune compromised or a diabetic, you're already more susceptible to having other gum issues. So running a risk of having a periodontal abscess for someone who is a diabetic and has heart problems already causes more risk of infection. So you really have to watch for those sorts of things and never ignore an infection. If you feel something starting, you should definitely have it evaluated.
Okay, so we've determined I have an abscess.
Okay.
What now? There are treatment options?
Yes.
Absolutely. So, I mean, usually because an infection starts out bacterial, the most important thing might be start an antibiotic. Go in, see your dentist, get an antibiotic, get that started, just to help the swelling go down, help some of the pain get relieved. And then based on x-rays, based on evaluation, based on so many factors, we kind of decide, well, what is the best option for you? Is it doing a root canal where you take out the nerve, clean everything out, and heal the infection? Or is it go towards an extraction where you can't save the tooth, and but if you remove the culprit of the infection, you've removed the infection. And then as far as if it's periodontal, well, you go in and you get the evaluation of what kind of cleaning do we need to clean out this infection, which is also associated with the bone and the gum level there.
Wow. There's a lot involved here.
It is a lot to think about, yes.
The best thing to do is stay on top of your...
You got it, and always
checkups.
seek help if you think something's happening.
Just in case.
Yep, just in case.
Doctors Lee Auke and Irene Sakelis with the Delmarva Dental Services, thank you so much for joining us.
Thank you.
Very important information for you.